Bismillahirrahmanirrahim. I am Mohammad Saydul Islam Sarkar from University of Chittagong, Bangladesh. I feel to say about COVID-19 to make awareness, to build awareness among the people and among the general people. Uh, because from the very beginning of 2020, uh, we have heard, we have learned a lot of about COVID-19, and we know there is no vaccines, there is no medications. Different countries are trying to have a trial. Uh, they have urged that they have created some vaccines and they are going to make a trial. So hope for the best. But we people are very confusing about the treatment, but because some of our physicians are saying there must have some symptomatic treatment. We can use some medicines, uh, we can take some medications uh, according to symptoms. And some of our doctors are saying to take antibiotic during suffering from pneumonia. So okay, fine, but it should be very clear. There must have clear statement, and they are saying, but I think there are some confusions. So first of all, what is COVID-19? I'm trying to say some answers regarding some questions. For example, what is COVID-19? How does it attack our lungs? How does pneumonia appear? And finally, what are the medications, symptomatic medications? So first of all, what is COVID? We know very well about COVID-19 because a lot of images, a lot of statements are observing every day through our social media, through TV channels, through news media. So it's a viral disease. We all know about it. It's a viral disease outbroken from Wuhan, under Hubei province in China at the end of the December 2019. So it is known as COVID-19. Since it's a new disease, so we are saying it's a novel corona virus disease 2019. That means novel corona virus or COVID-19, novel COVID-19. So what will happen if we attacked by the coronavirus? Sorry. We know there are some symptoms that will be observed from first day to the 8 or 9 days, and symptoms will be changed every after 1 or 2 days, and there will have some common symptoms will be from first day to the 9th day. So what will happen if they have an attack by coronavirus? So we know this will be entered through our hands, through touching our nose, mouth and eyes, and it will stay 3 to 4 days, someone says up to 5 days, within our esophageal region, and we'll have some sneezing, we'll have cough, and what will happen after 4 or 5 days, and what will happen when it will enter into the lungs. For your kind information, personally I am not a doctor. So far I have learned, and being a pharmacology teacher, I am giving teaching towards pharmacology. That was especially fish pharmacology, but I feel interest to know, to learn about medicines, pharmacokinetics, pharmacodynamics, and personally the treatment pattern, because from my previous job I was curious to know. So after 4 to 5 days, it will enter into the lungs through esophageal region. So what will happen when they will reach to the lungs? Simply, it will go towards the lungs, and it will reach near to lungs cell. And we know, as a student of pharmacology, virus that will be allowed to enter into the lung cell, then it will be able to have some infection or have some severe attack, and will have facility to multiply. So before entering into the cell, it will not be able to multiply, and because it will have favorable environment to multiply, and in order to enter into the cell, there must have some receptors. If there have no receptors, if there have no positive receptors, virus will not be able to enter into the cell. If receptors are present but did not allow COVID-19 to enter to the cell, lung cell, it will have no effect, it will no infection. But simply there are some receptors, and they will allow COVID-19 to enter into the cell. And after entering, what will happen? It will enter its genetic material through receptor within the cell cytoplasm or nucleus. And this cytoplasm and the inner environment of the cell will act according to the command of the genetic material, and it will allow to multiply, and it will rearrange new COVID-19 cell, and within a few days or hours, it will be multiplied huge in numbers, and ultimately when the cell is fulfilled by a lot of COVID-19 cells or strain, it will broken, and it will be ruptured. The cell will be ruptured, and this coronavirus COVID-19 cells, strain, will again attack a lot of cell nearby, and ultimately our whole lungs will be affected. If our lungs are being affected, what will happen? since we have our own immunological system, so our lungs and other pathogen killing cells, I mean neutrophils and killer T cells, all around our body will gather towards the lungs and will try to kill those COVID-19 virus. One important thing, this COVID-19 will try to make confuse and will make some puzzle condition within our killing cells that will kill COVID-19, and ultimately they will be desperate, especially for neutrophils and killer T cells. These neutrophils and killer T cells will come to kill the COVID-19 within our lungs. But side by side, since they are puzzled by the COVID-19 and they are too much desperate, so they might make some order to kill our own lung cell that is good, that is fresh. It's a tragic situation, but maximum will be ruptured by COVID-19. First of all, this COVID-19 will attack our epithelium, the outer layer of the cell. Then basement membrane. Then it will attack the subepithelial tissue, and that is COVID-19 is successful to kill our cell. So what will happen? Due to attack our ear sac alveoli that will suck oxygen from ear will be affected, and maximum alveoli or ear sac will be filled with either by fluid or by pus cells, and these alveoli will be hardened. It will make hard to breathe, and at that time we will suffer from suffocation. We will suffer from respiratory tract infections. We will not take breath. We will not easily inhale and exhale air, because due to attack of COVID-19, our alveoli will be hard and will be fulfilled with some fluid or pus cells. So it's a tragic situation. So I am already talking what is COVID-19, how does it attack our lungs, how does pneumonia appear. Now matter is pneumonia. How will it be happened? So after the attack of alveoli, ear sac, important part of our lungs that will exchange oxygen from air and supply towards the blood stream. Pneumonia will be happened either by virus or bacteria, even some fungi also responsible to have some pneumonia. If there is a pneumonia occurred by bacteria or virus, it will be transmitted. But if it is by fungi, it will not be transmitted one to others. So now, for example, a patient is suffering from pneumonia by COVID-19. One more important thing, we are saying this pneumonia will be acquired by COVID-19. But one important thing I would like to say, during the attack of COVID-19, there is a possibility to have secondary infection. The bacteria available in our lungs, and normally they are not able to attack our alveoli and to create pneumonia. But due to the attack of COVID-19, our cells are weak enough, our cells are suffering from illness. So at that time, these secondary pathogens, I mean some bacteria, especially it's a narrow spectrum bacteria, very less powerful. But due to the weakness of our alveoli, due to the lack of epithelium, all epithelium, maximum epithelium, basement membrane, and subepithelial tissue also to some extent ruptured. So at that time, secondary infection by bacteria will be happen. There is a possibility. So we might be suffering not only by the COVID-19 virus, coronavirus, but there is also a possibility due to the attack of COVID-19 to have some secondary infection. So it will be very tragic situation. So what will be the treatment? Our doctors or physicians are saying, okay, fine, if you are suffering from sneezing, if you are suffering from cough, if you are suffering from illness, okay, fine. If you are suffering from fever, you will take symptomatic medicines. So what about pneumonia? We are not clear enough about the pneumonia, whether it is either by COVID-19 or by secondary infection from bacteria. And some doctors are saying you can take antibiotic. In that case, I want to say, if they have an infection by COVID-19, my question is, will antibiotic be effective during this infection, during this pneumonia? No. If it is infected by secondary infection from a narrow spectrum or broad spectrum bacteria, then antibiotic will be effective, because antibiotic will act or react against bacteria, not against virus. So simply we will suffer from pneumonia infected by COVID-19. So in that case, antibiotic will not come in use. Okay, since we are not aware, since we are not well informed, and since we are not sure that is it by COVID-19 or by secondary infection, in that case antibiotic can take and there will have some use of these antibiotics. If they have a little extent infection by secondary infection through bacteria. If there is no bacterial infection, no need to use antibiotic, because this antibiotic will not act against virus or COVID virus. So I think this will make you clear. Remember, I am not saying to avoid taking antibiotic. Okay, fine, you can take antibiotic, but remember, if it is solely by COVID-19, will have no function, and this antibiotic will not be functional. And since we are in dark, so we can take, but and it will be effective against secondary infection. But we can say, is there any secondary infection or not? So we can take. So this is all about my today's video to make aware. One important thing, please don't be fatigued and don't suffer from stigma and don't feel stress. Just remember, just consider it's a fever, it's a disease caused by virus, and inshallah we will recover. We will recover our people. And don't make it panic to the society, and don't make it serious. Okay, fine, I'm just saying, be serious about your precaution, be serious to prevent it. But whenever you are suffering from COVID-19, don't be panic, don't be stigmatized, because so far we have seen, and you also see, death rate. We can conclude that what will be the exact death rate, but so far we are observing is not more than Ebola, not exceeding MERS, and still now not exceeding SARS virus death. So don't be panic, be serious about your protection, be serious about the protection of your family members, be serious about your neighbors, your society and your nations. Don't make it panic, please don't make it panic. Just relax and observe, just be aware and stay separate, stay home, and I think you will be safe, and you will lead a safe life, and you will maintain a safe life for your family members. So try to have a social distance, try to make a social distance. If you have a necessity to go outside from the home, and use hand gloves, mask and necessary precautions. I think you people are so aware and you are doing good. So no more today, I will come again if I have any new topic regarding COVID-19. So be happy, be safe, and final statement is no need to spread and no need to be panic. Thank you all.